Good day, everyone. I am Kimberly Malhin, and the topic that I am about to discuss today is about duodenal ulcer. A bit of information: this ulcer is under the type of peptic ulcer, and we all know that peptic ulcer are often sores that develop on the inside lining of our stomach and can be found at the upper portion of our small intestine. And this is what we call the duodenal ulcer. So what is duodenal ulcer? Again, this is the type of peptic ulcer. Anatomically speaking, this develops at our duodenum, which is our small intestine. So this is a part of our digestive system that foods travel through after it leaves from the stomach. So as you can see in the picture, the pear-shaped like is our stomach, and below there or after the stomach is a worm-shaped like, which is our small intestine. And as you can see, it is labeled here duodenal ulcer. So basically, duodenal ulcer can be found at the front row of the small intestine. So duodenal ulcer occur when there is a disruption to the surface of the mucosa of the duodenum, which is a sore that forms a lining in our duodenum. So later you can see what is duodenal ulcer looks like in the endoscopy view. So this kind of ulcer can be curable, so no need to worry, but if only it is diagnosed and treated immediately. So this can cause a person become full easily, vomiting, and have weight loss. So this is what duodenal ulcer looks like inside our small intestine. So as you observe, there is a visible white lining, and this is the sore that forms on the duodenum. So, etiologies. The most common causing this damage is an infection with bacteria called Helicobacter pylori, or what we rather know as H. pylori. So this bacteria can cause the lining of our duodenum to become inflamed, and then an ulcer can form. And other causes indicated with long consumption of non-steroidal inflammatory drug, also with the prolonged use of chemotherapy drug. So why NSA? Because this can cause ulcer by interfering with the stomach's ability to protect itself from gastric acids. And as for the chemotherapy drugs, this can cause mouth sores such as ulcers or infections. So chemotherapy can damage cells in the mucous membrane, so they become inflamed. And this can lead to painful ulcers, bleeding, or infection. So other contributing risk factors, which it is not the cause of the duodenal ulcer, but it can contribute to worsen the symptoms. So here we have smoking, alcohol consumption, stress, intake of spicy food, and ingestion of coffee, and then genetics. Okay. Clinical manifestation. So abdominal pain, we have symptoms of abdominal pain, having a feeling of burning sensation. So a person with duodenal ulcer will most likely feel pain when they don't eat after 2 to 5 hours after their last meal. So when they eat, then the pain will relieve. And also there is an observe of having bloated and abdominal fullness. And a person may experience nausea, weight loss, and have a dark tarry tools, or what we call the melena. So melena appears as a black tar-like sticky stool. So this color is often accompanied by a strong foul odor. So mabaho. So for our lab findings, we have here the H. pylori, which is the bacteria that mainly cause to contribute having ulcer. So the normal range value of H. pylori is we have a range of 30.01 up to 39.9, and if the range meet up this ratio, then we can call it then we can diagnose it having a negative pylori presence. However, if after diagnostic findings that it has been observed that there is an increased level amount of pylori that is found, and it is above the normal range, then the person is positive of having a peptic ulcer. So these are the diagnostic tests that can be done in order to determine presence of ulcer and also presence of the H. pylori. So for the invasive test, we have the endoscopy. So this is the non-surgical procedure used to look inside a patient's body. So it has a small camera that is to be inserted by the doctor for them to determine the type of ulcer that is present, whether it is duodenal ulcer or a gastric ulcer. So if your doctor detects an ulcer, then it is followed by immediately a biopsy procedure, which is done by getting a small tissue sample that may be removed from the patient body for examination in the lab in order to determine presence of infections such as H. pylori. So as you can see this on the first picture, this is the endoscopy, and the second picture is the biopsy. Now we have the non-invasive test, or what we call that this kind of test doesn't require to like slice the skin. So we have the urea breath test. So this examines patient's breath to look for presence of H. pylori bacteria. And we have stool test. It examines patient stool to determine presence of pylori. And lastly, we have the serology test, or examines patient blood to determine the presence of pylori. So here is our pathophysiology. So as you can see, the leading cause of this ulcer is the H. pylori infection and the use of non-steroid inflammatory drugs. And when a person take this drug or have a presence of H. pylori infection, then there is a possible contribution to increased gastric acid secretion. And if there is an increased gastric acid secretion, then it can possibly cause to impair the gastric mucosal, and then it can then lead to cause intense inflammation. So an intense inflammation can trigger having sores, and that source is a physical symptom of the duodenal ulcer. On the left side, we have here the risk factors that it is not the cause, but it can lead to contribute in worsening the symptoms. So here we have the symptoms of abdominal pain, bloated stomach, nausea, dark tarry stools, weight loss, abdominal fullness. Now let's proceed with the nursing diagnosis for patient with peptic ulcer, specifically the duodenal ulcer. So mostly we are to focus on the acute pain, also imbalanced nutrition, less than body requirements, since we have a symptoms of weight loss, anxiety. In some cases, patient may feel worried about their case, and then patient may also have deficient knowledge on the problem, GI problem, and then lastly, risk for deficient fluid volume. So an example of this nursing diagnosis is we have here imbalanced nutrition, less than body requirements in digestion, and gastric irritation as evidenced by weight loss. So our nursing considerations that we are going to do here, and we are going to give to our patient is we have first to record and monitor patient's weight daily. So this is to assess patient nutritional status. And then we're going to instruct patient to eat soft, bland foods and avoid eating spicy foods. As we recap earlier, spicy foods can aggravate or worsen the symptoms of the ulcer. And then we're going to advise patient to have an extra meal daily, recommend 2 to 5 hours after their last meal, since they have these symptoms of weight loss. So this is to compensate weight loss and prevent abdominal pain to occur. And then we're going to instruct patient to report severe symptoms, as this is to immediately aid the patient to alleviate pain and promote their comfort. So for pharmacological treatment, if ordered by the physician, we are going to administer H2 receptor antagonists such as ranitidine, cimetidine. So cimetidine drugs 30 minutes before their meal. So this is to protect the gastric mucosa and prevent irritation of the stomach while eating. And other drug, if ordered by the physician, can be administered of proton pumping inhibitor. So an example of this is pantoprazole, and this can have and decrease gastric acid secretion, and this can promote ulcer healing. So our health teaching to give our patient is we have to educate patient about the limitations of food, such as avoid eating spicy and limit alcohol and coffee ingestion in order not to irritate the GI tract. And then we're going to provide health teaching about the importance of smoking cessation, if only is the patient have a habit of smoking. So other example of nursing diagnosis, we have here acute pain related to abdominal muscle spasm as evidenced by verbalization of pain secondary to ulceration. So our nursing interventions that we are going to give to our patient are we're going to assess patient vital signs and characteristics of their pain after administering their medications. So this allows us to determine the drug effectivity towards our patient. And then we're going to instruct the patient to avoid non-steroidal inflammatory drugs as pain relievers such as piroxicam and aspirin. Because we all know with the use of NSA drugs, this can lead to GI irritation, and also it can contribute by worsening the stomach pain. And then we're going to monitor intake and output of the patient. So this is to determine that the patient have met the nutritional status. And then we're going to ask patient when was the last meal they had, because sometimes pain happens when stomach empty. So we have to make sure that the patient eat at least 2 to 5 hours after their last meal. So the pharmacological treatment, we are going to administer medication that alleviate the symptoms such as stomach pain, antibiotics such as amoxicillin, since this can kill the bacteria of H. pylori antacids and are helpful in neutralizing pain stomach acid. And the health teaching that we are going to give the patient is that we are going to teach them the importance of non-pharmacologic methods. So these methods can help to subside the pain. This involves by deep breathing exercises, music therapy, and any other forms of distraction that may distract patient thoughts about their pain. So here are the other list of medicine that can be given to a patient who is diagnosed with peptic ulcer. So for antibiotics, we all know that these are the first in-line drugs to help kill the infection, bacterial infection, which is the H. pylori. So we have here the pronoprazan, metronidazole, amoxicillin, tetracycline. And on the other side, we have the proton pump inhibitors, in which act, act as or work by reducing the amount of stomach acid made by the glands in the lining of our stomach. So we have here the pantoprazole, omeprazole, esomeprazole. So the nutritional therapy that we are going to instruct our patient or recommend to them is, here we're gonna emphasize having an extra meals per day, following that 2 to 3 hours after their last meal. And also we're gonna instruct them to avoid acid stimulants. So meaning we have to limit their food, and food, especially the stimuli, food that can cause to irritate their GI tract. So we have here coffee, spicy food, and alcohol. And lastly, we're going to create a meal plan chart that contains food with probiotics. Probiotics are termed as good bacteria. So example of this are such as yogurt, miso, tempeh, kefir. And also we're going to create meal plan that contains food rich in fiber, because fiber can lower the amount of acid in our stomach while easing bloating and abdominal pain. So that ends my report, and those are the clinical manifestation of those interventions and diagnosis and nutritional therapy that can be given to our patient to promote their health welfare. So thank you for listening.